you're new to Medicare because you're getting ready to retire, the scariest thing is you don't even know where to start because there's no Medicare office. Yes, there is a Social Security office probably near you, and Social Security is a good start. That's where you'll go and sign up for your Medicare. But a really good place to start is just calling a local insurance agent. Independent insurance agents only get paid by the insurance carrier. And they get paid basically to give you free information, to make house calls. We work with thousands of agents all around the country. If you don't have an agent that you already know and trust in your area, call us at Gord Marketing. You can go to our website and we can recommend somebody close to you. They can come to your house, meet you at Bob Evans, do a phone consultation. But an independent agent can tell you how you want to start to navigate these waters. Because unless you've helped your parents when they were on Medicare, most people don't know anything about Medicare and they're very nervous. If they look into it a little bit, they get very frustrated and they don't want to have to deal with it. Guess what? This is going to be your health insurance for the rest of your life. You're going to have to deal with it. Now, some of you are married and you're going to say, I'm going to let him handle it, or I'm going to let her handle it. That's great, as long as they live, as long as you live. But it's good to have a basic information of what is Medicare, the ABCs of Medicare. And if you look on YouTube a little bit further, I have a lot of videos that go deeper into Medicare. But what I'm talking to you about today in this video is, if you're a Medicare dummy, if you don't even know where to start by picking up the phone. Call somebody and say, hey, I'm not ready to buy something. That might weed out some agents right there that don't want to spend time with you unless you're actually willing to buy something, because they don't get paid to talk to you for free. But a good, solid agent will talk to you for free on the phone or in your house and say, I'd like to set up an appointment because I'm getting ready to retire in 6 months, in a year. I've had people say in 3 years, or I'm not sure when I'm going to retire. I'm working still and I'm nervous about my health insurance options, so I want to talk to you to figure out, to plan when I am going to retire. Call some agents. An agent's going to sit down and explain to you the basics. You don't need 8 hours of their time, but give you a basic idea. What's it going to be in your budget? If you retire today and your employer was paying for your health insurance and now you have to pay for it 100% on your own, what are we talking about? Is that going to cost me $100 a month, $500 a month? That's what you want to know, right? That might influence your decision to retire now or to work for another year. So an agent can give you an idea how much it's going to cost for your Medicare Part B, depending on your income. How much it's going to cost if you bought a Medicare supplement, one of the most popular types of insurance plans when people retire. You will need, in most cases, a Medicare Part D, a drug plan. So you're going to have 3 different set expenses for the rest of your life in most cases, and then we have the most expensive part and the most uncontrollable part, and that is the actual drugs that you take. How many drugs do you take? How expensive are your drugs? That's going to change over your lifetime. But an agent can give you a ballpark right now at picking up the phone or meeting with briefly and say, you know, if you retire right now, it's going to cost you, based on the drugs you take today, about $500 a month. And that's a really good starting point before you then delve into the other options you have in your Medicare choices between your different types of insurance plans, your different types of drug plans, whether you want to replace the life insurance you might have lost when you retired, whether you want to have dental and vision and hearing, which aren't included in these plans, but you might want to buy in addition. So start with a local agent. If you don't have one, give us a call at Gord Marketing. We'll refer you to someone near you.